Hello everyone. So today I start a new topic. Topic name is CPR. So let's start. What is CPR? CPR is a cardiopulmonary resuscitation. What is CPR? CPR is cardiopulmonary resuscitation. Okay. So anyone, if you want to write a definition, so please write. CPR is an emergency life-saving procedure. Is an emergency life-saving procedure performed when the heart stops beating. Okay, what is CPR? CPR is an emergency life-saving procedure that perform when the heart stops beating. Okay, next, CPR sequence. Okay, in CPR sequence you have to remember C, A, B. Okay, students, got it? Not ABC, right? You have to remember CAB. CAB. So CAB means CAB, CAB. C means compression. Okay. A is airway and B is breathing. Always you remember CAB, compression, airway, breathing. Okay, so next, there is steps. There are steps, few steps. So first one is for adult. Okay, I will show a table also, but firstly you have to remember or read or learn steps. First one is ensure scene safety. Okay, this is the always first step in NCLEX question. Firstly, you have to ensure scene safety. Second one is, this one is first. Second one is assess responsiveness. Okay, you have to ask like tap or shout, that's, are you okay? Okay, this is the second step. You have to tap or shout, are you okay? This is the second step, assess responsiveness. First one is ensure scene safety. Second one is assess responsiveness. Next, third one is call for help or activate cord if you are in hospital, right? Or get AED. If patient is unresponsive, then call a cord, ask for AED and start CPR. Got it? This is third step. You have to call for help or activate cord and get AED. If patient is unresponsive, you have to call a cord, ask for AED and start CPR. That is cardiopulmonary resuscitation. Next step, there is fourth step. Now check pulse. So you have to check pulse no more than 10 seconds. Okay, you have to check pulse but not more than 10 seconds. So you have to check carotid pulse. In fourth step, you have to check carotid pulse. If no pulse, if patient having no pulse, so you have to start or begin compression. Got it? In fourth step, you have to check pulse but not more than 10 seconds. Okay, if there is a no pulse, so start compression. So here is fifth step. Here is fifth one. Fifth one is start chest compression, but there is rate and depth. Rate is 100 to 120 per minute and depth is, this is for adult, okay, at least 2 inch. In fifth step, you have to start chest compression, but there is rate and depth. So rate is 100 to 120 per minute and depth is at least 2 inch. Depth कितनी है? 2 inch, right? Next, we have sixth step. In sixth step, you have to open airway. There are some method, that is head tilt, chin lift. You have to do head tilt, chin lift. Okay, chin lift method. But if there is trauma suspected, that is jaw thrust, so do not perform head tilt chin lift method. So seventh one, give breath. So each breath having 1 second long. Watch for chest rise and avoid hyperventilation. In sixth step, you have to open airway. You have to use head tilt chin lift method. Okay, if there is unless trauma suspected, you do not have to perform that method. Next, in seventh step, you have to give 2 breaths. Sorry, I have missing. You have to give 2 breath. Okay, each breath having 1 second long, and watch for the chest rise and avoid hyperventilation. Next, there is 8th step. Use AED as soon as possible. In last step, you have to use AED. Okay. So next, there are some medications. CPR, medication. Okay. Medication name. First one is epinephrine. Okay. So use 1 mg every 3 to 5 minutes. How much mg? 1 mg every 3 to 5 minutes. Next is amiodarone. Uses for VF, pulseless BT, pulseless ventricular tachycardia, not responsive to shock. First one is epinephrine. So we have to use 1 mg every 3 to 5 minutes. Second one is amiodarone. So where we have to use for ventricular fibrillation, pulseless VT, that not response for the shock. Next medicine is atropine. Okay, this used for bradycardia. And fourth medicine that is magnesium sulfate. Uses for torsades the points. Third one is atropine, so we have to use in bradycardia. And fourth one is magnesium sulfate, so used in torsades points. These are the medication. First one is epinephrine, second one is amiodarone, and third one is atropine, and fourth one is magnesium sulfate. So in next video I also continue this CPR. Thank you.